Hello, we had another baby.
Just had another baby.
Yes, and so this week we are going to kick off our newborn series, and we are talking all about that first pediatrician visit. What should you expect when you go?
Yep, and just in case it's your first time meeting us, I'm Kurt, I'm a board-certified pediatrician.
I'm Sarah, I'm a board-certified OBGYN.
And we are the Doctors Bjorkman.
Welcome back. If you are watching this, I'm guessing maybe you just had a baby or are going to or just like learning. But today kicks off the beginning of our newborn series. So if you have followed us for a while, you may remember that with our first pregnancy, we kind of went week by week with kind of pregnancy milestones and what to expect, sharing our medical expertise as well as kind of our what's going on in real life. So with baby number 2, our plan is kind of to do that as a newborn series and kind of go do those first couple weeks, week by week, and then go to month by month, milestones, development, what to expect, things that are happening in your parenting world.
Exactly, and just like we did with OB series, like we've got the benefit of having an OBGYN,
Yes.
And then also a pediatrician. We're gonna dive into that first pediatrician visit.
Yes.
You've now maybe made it through the first 24, 48 hours at home, and what kind of things you need to think about to be prepared for that first visit. Now, the American Academy of Pediatrics actually has pretty specific recommendations to guide pediatricians and primary care providers about how often they need to see infants during the first year of life. Recommendation is that first visit happens between days 3 and day 5 of life. And if you were to go home in the first 48 hours of life, that visit happen actually even sooner within the first 48 hours of being home. Again, just making sure that any potential things that happened with babies, newborn transition, or with how they developed in utero, giving a second chance to be safe and make sure everything developed normally.
The pediatrician at the pediatrician's office, trying to get his kid undressed. You're doing a great job. He looks so happy about it.
I'm that stretch to this guy. There's a little baby in there somewhere.
All right, so that brings us to the very first thing when you are going to see the pediatrician for that first visit. I guess the first thing is actually getting out of the house.
Yes, can sometimes be a challenge.
It really can. Getting the baby in the car seat, getting yourself dressed. You just, left the hospital. You just had a baby.
You maybe haven't slept in days.
Yes, so it can be a struggle. Your pediatrician knows it's a struggle, so they will give you grace if you are running a minute or two late. Everything takes longer when you have a itty bitty baby.
Yes.
But when you get to the pediatrician office, kind of the very first things they're going to do is measure that baby.
Yeah.
Head circumference, how long they are, how much they weigh. And so they're going to have you strip baby down to a little diaper, and you can kind of see here, take all their measurements.
Yeah.
And then with that, kind of the biggest thing they're looking at is weight, and you can talk about that.
Yeah.
But at the end, they'll show you where baby is on a growth curve for kind of percentiles for height as well as for weight. And this is something that they're going to watch at every single visit. Hey, is this baby kind of staying on its growth curve? Is he or she falling off? Etc.
Yeah, and the really biggest measure of all of these that kind of everyone's going to pay the most attention to is that weight number. So some of this is where is baby growing on their percentile, but how is the weight changing from that birth weight and hospital discharge weight to this first visit? And we actually expect a baby to lose weight in the first couple of days of life. Actually, up to the first week of life, they may lose up to 10% of their total body weight.
Where we're not alarmed.
Yes.
They can lose more. That's why you're going to see the pediatrician, but kind of that 10% mark, as we say.
Within normal.
Yes.
And a lot of this is babies working on feeding, they're learning all of these things, their body's transitioning out into like being in the world. And so this is an expected thing. Babies are designed, they come out with extra fat stores on board to be able to kind of get them through this week, but then kind of as that end of that first week ends and by the time they're 2 weeks of age, they're kind of getting back to their birth weight is kind of the goal that we think about and expect them to do. One special caveat to this is if you had a C-section, sometimes those babies may lose actually more than 10% of their body weight. And a lot of that is just related to the fact that oftentimes around C-section, mom is getting IV fluids, and some of those fluids actually are seen by the baby. And so their first weight in the hospital may be actually kind of falsely elevated because they've got a little extra just fluid weight on board.
And that's kind of a note that lactation consultants are very passionate about,
Yeah.
because sometimes, you know, if you weigh the baby, it looks like maybe they lost more weight than they really did, and then you start supplementing earlier before you need to. So just something to keep an eye on.
Yeah. Which brings us to the second point, and that is feeding.
Yes, so feeding is a challenge, whether you are breastfeeding or bottle feeding. You've got to figure out what to do and what your baby needs. So if you are bottle feeding, formula feeding, generally your little tiny baby is going to be taking 1 to 2 ounces every, 2 to 3-ish hours. They have tiny little bellies that are growing, and so again, 1 to 2 ounces during that first week or so. You can gradually kind of allow them to take a little more volumes, but you never want to try to coax them to take more or do anything like that, because that can lead to overfeeding and eventual other problems down the road.
Yeah.
So,
And just like when you were in the hospital, the nurse was coming in asking like how often baby feed, things like that. The questions your pediatrician is going to ask you are like largely the same in terms of how often is baby eating. If you're breastfeeding, how long are they feeding for? Are they having any challenges with feeding? Or if you're bottle feeding, what kind of volume are they taking per feed? And how long is it taking them to finish a bottle? This kind of gives us a lot of information about just how is that feeding relationship going between parents and baby. But then also this is baby's exercise. If you think about it, we don't ask babies to do a whole lot. They sleep, they pee, they poop, and then they have to eat. And that is really their exercise.
That's a lot of work.
A lot
for
of
those
work.
babies. Yeah.
And so this is kind of like an exercise test for a baby in terms of how is their stamina, are they having any issues with that. It can be pretty normal for babies to still be very sleepy with feeds, and so sometimes they just need a little encouragement if that's what's going on for you. But it's also just this extra time and chance for the pediatrician to evaluate how is baby doing from a feeding and exercise standpoint.
Yes, and for breastfeeding, we talk about 1 to 2 ounces. When you are bottle feeding or giving formula, you can see how much baby is taking, and it can be kind of frustrating if you are trying to breastfeed because you're just like, I don't know how much baby's getting. So your pediatrician, as you mentioned, is going to ask how long baby is nursing for, and so that is kind of the metric you're looking at when you are breastfeeding, is how long are they nursing for. We generally recommend, you offer one side, they're going to eat on one side, and then you offer the other side kind of as dessert. So some little tips there.
Yeah. And then one of the next things that the pediatrician is going to look for and ask and test for during this visit is going to be a bilirubin or a jaundice assessment. And so we talked about this a little bit in that kind of first day in the hospital, but all babies are at potential risk for having increased bilirubin levels or jaundice. This is the yellowing of the eyes and the skin. Just as they're transitioning to the world, their blood is actually changing itself too, and there's some blood breakdown. And then one of the byproducts of that is bilirubin. Really high levels of bilirubin can be dangerous to the brain, which is why they check it in the hospital before you go home, and why your pediatrician is going to check it at that first visit. Sometimes they have to do a blood test for this, but most offices are actually able to use a transcutaneous sensor, which is just a little special light that they stick on the skin, and then it gives them a very good estimate of what the true levels of bilirubin in the blood are, and that can kind of tell them, do they need to do more testing or not. Good news, if your baby does have a little bit high levels of bilirubin, the treatment for this is often just special lights and phototherapy. And so
Keep eating.
And keep eating.
Keep eating those little
Because the way baby gets rid of bilirubin is by pooping, and if the phototherapy actually helps change the bilirubin so that they can also pee it out too, which is very cool.
So we're at the pediatrician. What happens next?
Yeah. Other kind of important things that are happening just even in the intake part of the visit is making sure all the other newborn screens happen too. So much like we talked about, these are going to be things like the hearing screen, then the congenital heart disease screen as well. I think something really important about the congenital heart disease screen is it's really good at picking up many cyanotic heart lesions, but it also is really important that your pediatrician is going to do the exam as well.
So we've weighed them, measured them, checked vitals, checked bilirubin, made sure all the screening was done in the hospital, that congenital heart disease screen, their hearing screen. At this visit is also a time when your pediatrician is going to look and see if that newborn screen has returned yet.
Yep.
So in the hospital, usually they do a heel prick to send off a blood test for some genetic conditions. They're autosomal recessive conditions that can be very devastating to little babies if they are missed.
Yep. And they're all very easy to miss too, especially in this newborn period. It may take a while for them to kind of show up with true symptoms, but if
They're rare. They
they're
are
rare.
very rare diseases, but
if you detect them and treat them, you can limit all, if not most, of kind of the devastating consequences of them with early detection and early treatment.
yep. So your pediatrician is looking for the results of that test to be coming back at that first week visit, those early visits. The number of conditions screened varies from state to state, so you can look these things up to see what they're screening for.
It's usually around 50 though. And this also, if you've had a home birth or a birth outside of a hospital for whatever various reason, the screen can be done at that first visit as well as kind of the other screenings, and we would highly, highly recommend those be done just in terms of making sure your baby is assessed for all of those things.
And that you're not missing anything.
Exactly.
Yep.
And then comes probably what is the biggest part of this visit is the physical exam. And I say it's biggest, it ends up being pretty quick. Pediatricians get very good at kind of going through their list of things, but this is the baby's first head-to-toe assessment outside of the hospital, and really a great chance for their primary care provider, their pediatrician, their family doctor to make sure and look in detail specifically for any things that may have not formed properly in utero, some signs that maybe something may be off, and then also there's certain conditions that can be really hard to detect in the first 24, 48 hours that may start to present already at this first visit, specifically some congenital heart lesions that can be hard to detect in the first 24 hours that as their physiology is changing can be a little bit easier to detect at this first visit. So when we were training in med school during our pediatrics rotations, and then for me as a pediatrician in residency, et cetera, kind of had this list of about 45 to 50 different things on our checklist of, hey, every time we do this exam, we're going to look at these things. We're going to look at how they appear, how they're interacting, their tone.
Their reflex, the specific baby reflexes, their eyes, their heart, their lungs, all the head to toes, 5 fingers, 10 fingers, 10 toes.
Yes. Other important things are hip exams, especially thinking about like how baby was positioned.
If baby was breached, things like that.
And so all of those things become very important, and this is why it's so important to see someone who's really well trained at doing a thorough physical exam. It may not seem like much, but this is such a huge skill, and really why we rely on going to see a pediatrician other than myself, because it's so important to have someone who's really trained and just has another set of eyes on your baby.
We do get asked that a lot, like, does Kurt see your kids? And the answer is no, for many reasons. One is that generally it's not recommended you take care of family or friends because you just have this bias because you know them and you don't want to miss things, and so besides other social layers, there's also like we always want to take really good care of people, and sometimes you just miss things because they are the people closest to you. You don't always see the details. It's also really wonderful to have another expert come alongside you and make sure that you're doing everything you can for your little babies. And so, really smart people are looking and making sure everything's going okay with our babies. And so, anytime you have that opportunity to partner, and like your pediatrician or family doc, whoever's seeing your kid, nurse practitioner, they want to partner with you and help you be successful in raising this little human. And this is what they do all day, is take care of babies and kids, and they have so much experience and so much great advice, and like, hey, this is what's coming ahead. And so
which ends up being kind of the other big part of this first visit is something called anticipatory guidance. So like, what are the things that the pediatrician feels like is really important for you to know as new parent, kind of to anticipate between this visit and the next time they see you? What kind of transitions are you going to see in sleep patterns, in feeding patterns? What are reasons to call them, etc.? And so you're going to be in this fog of having a newborn at home, and you may not remember much. Oftentimes pediatricians are well prepared for this and hopefully give you a little handout of some of the key highlights. That's why it's great if you can go with your partner too, because it's just an extra set of kind of sleep deprived ears to listen. And so this ends up being another really important reason why we love to go see someone other than myself for care of our children, because we're always learning, much like you're here learning too. Like, we're always trying to learn how do we make sure our children are healthy, make sure we aren't missing things. So, which then brings kind of, I think we've got 2 last things, and both very important. One of them being, how is mom doing?
How's mom doing? So this is another kind of touch point where someone in the healthcare system also wants to check on mom, birthing person, making sure you are okay. Some pediatrician's office are going to do a postpartum depression screen. They're certainly going to ask, they want to know how you're feeling, how you're sleeping, how feeding's going. They'll talk to you about your delivery and your pregnancy. You know, did you have any complications during pregnancy? Did you have preeclampsia? What position was baby in? How long did you push for? Different things. Did you have any health problems during pregnancy? Were you on any medications during pregnancy? Things like that. So they will also be getting that history about you at this visit. And again, checking in with you. Having a newborn is really hard. It's just this constant needy thing that just doesn't.
That is irrationally irrational.
Yes.
Does not respond to any reasoning.
No, and
no matter how compelling your argument is.
yeah, and it's just a lot. And so there are people who want to check on you too and make sure you're doing okay. Another, if you are trying to breastfeed and having a hard time, a lot of times clinics will have, pediatricians' offices have access to lactation or have one built into their office. So that's another place for you to check in if you are needing help. Please, please, please get it.
Yeah. And then the final part of this visit is actually packing up to go home. And this is something that I encourage you to use this opportunity to make sure that you're doing everything from a safe standpoint with the car seat. And so many car seats, I know ours has a detachable base, which we love for this newborn phase. And so if it's in there, it's a nice time to even just like ask the pediatrician or the nurse, like, hey, do we have baby in here
In this infant
correctly?
car seat
Yes.
correctly. Yep.
Yes. And so like, this is just another like part of this new parent role is like making sure your kid is safe in travel in the car.
Yes.
There's so many ways to incorrectly put your child in the car seat. Some key things, making sure those straps are snug. They should be tight enough where you can't kind of pinch the strap down on itself. It's a nice way to make sure it's snug enough. Other key things, if it's cold where you're at, winter coats need to not be under the
Or
straps
big
themselves.
blankets, and that little chest strap thing that clips. It's at the armpit level. It's, the things that clip.
Yeah, and the big thing with the blankets and the jackets, the reason you put those not underneath the straps is it's actually amazing if you were unfortunate to get in an accident that they can compress and baby could potentially slip out. You want the straps to be tight against the clothes and have all kind of those warm outer garments kind of put over the top. I know it's a big hassle and taking baby in and out of those things, but
Start the car. If it's winter, start the car before 10 minutes before you
or
have
if
to
it's
leave.
summer, maybe put on the air conditioning first too.
Yeah.
All of these things, thinking about how can you help make that transition a little bit easier.
So safe car travel and safe sleep is the other thing that will be talked about. Or at the pediatrician's office, they're going to say, hey, where does baby sleep? How is sleep going? It's such a big thing. And safe sleep is little babies on their backs in a crib without anything else, no bumpers, no blankets. You can swaddle them. We've got a swaddle video, but safe sleep is really important to prevent SIDS, and so that's something that they'll touch base about at your appointment too. So if you have any questions, write them down in your sleep-deprived state to make sure you don't forget. If you have things you want to ask the pediatrician when you're at home, I know I'll get into the doctor's office and leave and then be like, oh, but I wanted to ask this one thing. And so make a list.
Yeah, definitely you've made it through the first day or two at home, and so like do things that set yourself up for success. Your pediatrician is there to be that backstop for you to say what are the big things we need to do to make sure baby is healthy so that you can just focus on being parent. How are you going to feed this baby? How are you going to keep the diaper changed? And how are you going to try to get some sleep for your family in that first week? So we're going to be back, I think, in the next couple of weeks with episodes all about the first week for mom, the first week for baby, and then continuing kind of going through development and normal health things for baby for this first year to come. So make sure you subscribe to catch all of that. We'll see you guys next week.
We'll see you next week.
Bye.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.